Hi, I'm Adriana Soveral, Information Officer reporting for the Ministry of Health and Social Development with today's GIS Report. My guest is Noeline Levins, Clinical Supervisor with the National Health Insurance. Thank you for being here, Ms. Levins.
Thank
How
you
are
very
you?
much, Ms. Soveral. I'm fine, thank you.
All right, so we're gonna go right into it. How is NHI?
NHI is a process. It's a work in progress.
All right.
Yes, it is.
So today we're going to talk about the beneficiary process and what persons should know. So I'll just ask you straight up on what is a medical referral?
A medical referral is a written request from a doctor to a patient for specific services, be it a test, a procedure, a surgery, or as in the case of a specialist referral, transfer of care from a medical doctor to a specialist.
Now take us through that process step by step from the initial visit to, when the patient comes to NHI and gets their referral and goes to the specialist.
Okay, so patient A sees Dr. Z for because they're not feeling well. Dr. Z determines that the patient needs to be tested, and so may send them to the lab for blood tests as well as to the X-ray department for an X-ray. Because these are basic assessment tests based on our benefits package, they do not require pre-authorization. So requests for ultrasound, chest X-ray, X-rays, blood tests does not come to NHI for authorization. Automatically, that's covered. Patient may take the results back to the doctor, and the doctor may decide something looks suspicious, I may require advanced testing. This is where a NHI pre-authorization request form BA002 is submitted to NHI. Form BA001 is submitted to NHI for pre-authorization requests. It comes to the clinical team, and the team is headed by a manager, Mrs. Norma Benjamin, who works in collaboration with our medical director, Dr. Harlan Vanterpool. There are two intake officers, Ms. Stephanie McTavius and Ms. Anna Richards. They enter the data into our database for that episode. So patient's A information is inputted into our electronic database, their name, the date, and for how long the service is going to be covered for, whether it be a month or 2 months or 3 months. And my role as clinical supervisor is to review and assess each referral case by case individually and determine if it needs to be reviewed by senior management, if it's a bit more complex, or it's based, for me, my role is based on three things. The first one is eligibility. I am responsible for ensuring that the person is eligible for NHI coverage. Some persons may not have registered. Some patients may have registered but are not up to date with their monthly payments. And so we have to make sure that the patient is eligible for services. The system is so awesome that it's designed in a way that if they see the doctor or they go to a health facility and something is off with their eligibility, there'll be a flag. The facility will not know what it is, but that flag will allow them to contact NHI to query. The situation might be able to be resolved in our office at that time, or we may ask the patient to come in and let us see what needs to be done. After the information, besides eligibility, I also authorize or deny referrals based on accumulators. And accumulators is a big word, but it basically means how much money you have used for a specific service.
Okay.
So, for example, diagnostic testing like MRIs and CT scans, all persons in the territory who are covered by NHI have a maximum of $1,500 assigned per year. Dental services, $1,500. So if you are referred for an MRI and you have an MRI done, the amount of money that was paid for that would definitely max up to $1,500, and so you will no longer be able to have another MRI for the year. If the doctor needs a second one, that would have to be paid for by the patient out of pocket.
Okay.
Yeah, same for dental services, and every procedure has a cap. It has a maximum amount assigned to be paid for by NHI. And the third thing that I look at when looking at a referral is medical necessity. Does the patient have to have this test? Is the request for surgery based on clinical guidelines? NHI utilizes management care guidelines, MTG guidelines, and these are international standards which guide what we do. So when we approve a procedure or surgery or test to be done or deny it, it is not based on our individual
preference.
discretion. Right, it's based on clinical guidelines. And it's very important for doctors to ensure that they give us enough information to ensure that the patient's referrals can be dealt with accordingly.
Now, in dealing with it accordingly, what is a normal timeline of when you receive the referral and get word back to the patient?
Awesome question. So we prioritize our response time for medical emergencies such as a critical illness, an accident, something that's really an emergency. That's dealt with within the first 24 hours.
Okay.
For NHI processing. In most cases, the hospital will contact us and let us know that they have to medically evacuate a patient out, and we must deal with that. The turnaround time for that is 24 hours, 24 to 36 hours, no more. For urgent cases, things that are important but could probably wait a day or two, 36 to 72 hours. For routine cases like biopsy, upcoming surgery, we have a 14-day turnaround time.
Okay.
Yes.
So, what is the expectation for the patient and providers? What's the patient roles? What's the provider's role?
Okay. So patients, I believe, need to understand that the agreement is between NHI and the facilities. So for a patient to take an NHI pre-authorization request form and bring it to NHI is not the way to go.
Okay.
We encourage patients to refrain from doing that and allow the facility to do what they have agreed to do. Once the doctor sees the patient, decides that they need a service, they will give the patient a referral in their hand to either take to the same facility or a different facility for a service. But the doctor or the facility is also responsible for submitting the NHI pre-authorization request. And that is what we will use based on the information that we have asked for to process the referral and to assign coverage accordingly.
Now, how do they submit? Do they email?
Email
do they
or
call?
fax. They send it in by email or fax.
So can referrals be made out of the territory?
Oh, definitely. We have patients who need services that are not available in country. And so we will have to coordinate the care. And that coordination is based on cost of care, closest destination possible. So if a service is not available in the territory, we will look to the USVI.
Okay.
If it's not available there, then Puerto Rico. There are some patients who do not have a visa and may not be able to access services in any U.S. territory. And so we look at the Caribbean, Jamaica, Trinidad, Barbados. We go all the way down to Colombia, Panama. I'm telling you, as a Caribbean citizen, I am proud of the services that we have available. I'm also proud of the cost of care. It is affordable, it's manageable. Once we hit the U.S. mainland, you're looking at way more. But like I say, we look at closest destination possible, we look at cost of care, we look at medical necessity, and we try to work with the patient to get them the best care that can be afforded to them at the most affordable cost.
So, Ms. Levins, you said that referrals can be made out of the territory.
Yes.
Then after, what should patients expect? Does NHI cover the cost attached to referrals made out of the territory, and what is that cost?
NHI covers a certain percentage of our usual and customary rates, which means that with the 95% that we cover at PBILS and the BVI Health Services Authority, 90% within the private healthcare services for private medical centers, and 60 to 80% overseas. 60% if the provider that they're going to is not in our network, or 80% if they are in. A lot of patients believe that because NHI is covering 90%, it's going to be 90% of the whole $100 that they're supposed to pay for the test.
So if it's not the $100, then what is it?
Right. It's called balance billing, where private facilities are allowed to charge any amount that they desire. NHI pays 90% of our usual and customary rates. So if the cost of your test is $100, NHI may only cover 90% of $50. You as a patient, you're also therefore responsible for the 10% of the $50 plus the additional $50.
So is it okay for a patient to go into a facility and say the doctor says that they need, I don't know, let's say an x-ray. The doctor says that you need an x-ray. Is it okay for me now to ask the doctor, well, how much is this x-ray?
Yes, that is the patient's responsibility to ensure that they inquire, and it is the facility's responsibility or the doctor's responsibility to say the test is going to cost this amount, NHI will cover this amount, and so your out-of-pocket payment or your co-insurance is this.
Well, sometimes I have never experienced where the facilities are upfront. I find that they'll say, well, maybe it's kind of sort of around this amount. So, I mean, how do you deal with something like that as a patient when you go into a facility and you ask, oh, I have an experience. I see a dentist.
Yes.
And it was around the time that NHI came into play. And I know with my before insurance, I paid about maybe $80 something for a checkup.
Mm-hmm.
So I know that with NHI, it should be a little bit different. I didn't know whether it was going to be more or less.
Right.
So then I asked them before, when I made the appointment for my new upcoming visit, well, what is it now with NHI?
Mm-hmm.
And the receptionist, I'm guessing, she was like, it should be $34. I was like, oh, okay, $34. I wrote it down. I put it in my phone. I put it in my appointment for 6 months later.
Yes.
And then 6 months later, my phone alarmed. Your dentist appointment is tomorrow. I was
Yes.
like, oh, okay. And then I was like, how much money should I walk with? Oh, yes, she did say $34. Yes. I go, have an appointment, and when I come back out, she charged me $60. So I said, oh, what? You told me 34 6 months ago
yes,
when
yes.
I made the first, and she was like, no, it's 60.
Yes.
So what would be my response? How do I combat that? How can I protect myself in case something like that happens to me or anyone else?
Okay, NHI utilizes a fee schedule. Every single test, procedure, surgery, anything medical has a code assigned to it. It's coded. And that code has X amount. And it's not just NHI. All insurance companies use a fee schedule.
Okay.
How much that insurance company will pay for a particular procedure. It is the facility to, like I said, cost how much they want to charge, and it's also their responsibility to let the patient know in advance. You inquired 6 months before. As a patient, I would say one of the best ways was to contact the facility probably like a week before, coming closer to the date, just to make sure that the amount that you were given before is still the same, or if it has changed, so that you can budget accordingly.
That is my next question about patients. Can they see specialists prior to, if I feel like I don't want to go through that referral process, I already have a doctor, maybe the doctor doesn't accept NHI, can I go ahead and see the doctor and then come back with a receipt to claim?
A lot of people believe that you can just do your own thing and then NHI will pick up on the back end. And we are able to reimburse, but it's a process. And remember I said the pre-authorization, letting us know in advance, this is what you want to do, and having a discussion to find out if that provider is in our network, if they're willing to accept payment from us, or if the services are medically necessary. Sometimes patients want a service that they don't need. You know, so it's always good when they can dialogue with us beforehand, before they leave the territory, and ensure that they have pre-authorization approval. If they don't have it and they go, their receipts that they bring back may be denied. It may be accepted or it may be denied. It all depends on the situation. But it's always good to touch base with NHI first, because cost of care is very important. It's a very important factor.
Oh yes, no one wants any extra cost.
Yeah.
So is there anything else that you would like to add before we close off?
Okay, one call to action I would say is for providers and patients to ensure that as much information as possible is conveyed. NHI is an established organization, statutory body working with Social Security to ensure healthcare for all, equal access. In order to process a lot of referrals, which I do, information. So the patient needs to tell the doctor everything, let the doctor know what's happening when they go to see them. And doctors need to let NHI know that yes, this and this and this and this has been happening, and so the patient needs to have this. Because you are the patient advocate. You have to let us know what we're assigning money for and why.
All right. Well, thank you so much,
You're
Ms.
welcome.
Evans.
Thank you too.
It was a pleasure.
Same here.
That was my guest, Ms. Noeline Levins, Clinical Supervisor with the National Health Insurance. We spoke about the beneficiary process and how persons can maneuver the referral process. For more information on the National Health Insurance, persons can visit the website at www.vinhi.vg. For more information about this program, persons can subscribe to the Government of the Virgin Islands YouTube page or like us on Facebook at the Government of the Virgin Islands. Again, reporting for the Ministry of Health and Social Development, I'm Adriana Savarall with this GIS Report. Thank you for tuning in.